Hello and welcome to our special show, Health and Wellness Save a Life. I'm Gargi Rawat. Now imagine a scenario where someone or a loved one suddenly collapses in front of you after a cardiac arrest and you can't do anything. These days, even young adults are suffering from sudden cardiac arrest due to the sedentary and stressful lifestyles. The good news is that most of these lives can be saved. It has been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that a majority of cardiac arrests occur at home. Now, CPR knowledge will equip you with the skill and the confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who will help you understand the role CPR can play in revive and saving a life. We're joined by Dr. Prasad Andhare, consultant and interventional cardiologist, Andhare Heart Clinic, Nandurbar, and Dr. Abhijit Aklujkar, interventional cardiologist, Director, Cordis Hospital, Mumbai, and Dr. Satvi Singh, consultant interventional cardiologist, BLK Super Speciality Hospital in Delhi. Thank you so much, doctors, for joining us on the program and to talk about this very important issue. Dr. Andhare, first to you. There are growing incidents of sudden cardiac death in India. Even a relatively young population is also dying on the spot due to cardiac emergencies. Why are cardiac emergencies increasing, especially in young adults?
So as we know, the cardiac emergency, heart attack and all the cardiovascular diseases are very rampant all around the world and majorly seen in adult population, which have adult population who are commonly suffering from comorbidities such as hypertension, diabetes, cholesterol issues. But in recent years, we have seen that there are increasing number of younger population presenting with cardiac emergencies. The most common and important causes will be unhealthy lifestyle, mainly unhealthy diet, lack of exercise, sedentary lifestyle, and stress. So stressful lifestyle, which can be related with their studies, their careers, urbanization. So all these unhealthy and stressful lifestyle lead them to get indulged into alcohol, tobacco use, smoking, and eventually increase their risk for cardiac arrest and cardiovascular diseases.
All right, Dr. Aklujkar, as most people still don't know the difference between, heart attack and sudden cardiac arrest, many people may mistake recognizing these symptoms. So how does one know if it's a primary cardiac arrest?
See, in heart attack, the most important problem is the patient gets a chest pain and he can always get breathlessness, some uneasiness in the chest, feeling of something very bad happening to his body. This is the symptoms which he gets in a heart attack. The chest pain can get radiated to the hand. Sometimes in women especially, there can be vague symptoms like gaseous distension of the abdomen. So these are the symptoms for heart attack. But especially in case of cardiac arrest, you have to understand the heart has stopped. When we say cardiac arrest, that means the heart has arrested. So when the heart arrests, there is no blood flow to any organ of the body. So the blood flow to the brain stops. So the patient collapses and the patient is unconscious. So whenever there is a cardiac arrest, the patient is fallen down and therefore we need to go and check whether the patient is breathing, whether he is having a pulse. So the difference between heart attack and a cardiac arrest, the cardiac arrest, the heart has already stopped, and heart attack can lead to cardiac arrest. So there are multiple reasons why we can get cardiac arrest, but one of the reason could be heart attack. So these are two different entities. Heart attack is blood supply to the heart has decreased and the patient experiences chest pain or breathlessness, and cardiac arrest, the heart has already stopped and you need to take immediate action, otherwise the patient will die.
All right, Dr. Andhare, what steps should a bystander follow if he or she recognizes that someone is having a cardiac arrest?
So when you see someone is having a cardiac arrest and falls unconscious in front of you, immediately look around and shout out loudly to call someone for help. If there is someone around you, ask them to call for emergency medical services such as 108, which is number for Maharashtra and various states. So, and if you are alone at the site and only person who can help the person who is suffering from cardiac arrest, first and the most important thing is call for medical emergency services. Check whether patient is responding to your verbal command or tap on the shoulder. If patient is not responding, start immediately the quality CPR. Quality CPR is very important. Once you start CPR should be continued till the patient regains consciousness or till the medical emergency services arrive at the spot.
Okay, so that's important to keep in mind, and it's important we all get educated on this. Dr. Klutchkar, if cardiopulmonary resuscitation is a life-saving technique, so what exactly happens during CPR? If you could explain to our viewers.
Yeah. In CPR, what actually we do is whenever the patient has collapsed, as doctor was telling, so you go and see whether the patient is responsive or not. If the patient is not responsive, then what you need to go and check is you check the pulse of the patient, whether the pulse is there or not, and you check for the respiration. So you look at the respiration, you put your hand on the nose of the patient and see whether there is any breath you can feel on the top of your hand. So if there is no breathing, and the chest expansions also you can look at for the breathing. So if there is no pulse and there is no breathing, then you immediately start doing CPR in this patient. So if you are a single bystander, you have noticed that the patient has fallen down because of cardiac arrest, you not need to start CPR immediately. And the procedure is that after every 30 compressions, you give 2 breaths. If you have a single person who is doing CPR. But if there are 2 bystanders, if you have 2 people who are trained into CPR, then what you can do is for 15 compressions, you can give 2 breaths. So one person will be doing chest compressions and another person will be giving mouth to mouth respiration to the patient. So this is how with CPR we help the patients regain consciousness or maintain the pulse of the patient and the circulation of the patient throughout the body. So it is very important to know that the CPR needs proper training. Not everybody should do CPR. A trained person should do CPR. So CPR training is very important in every family, and every family, at least one person should know how to do CPR.
All right, that's very important to keep in mind. That at least somebody in the family must know about CPR to help if any family member is suffering from a cardiac arrest. Dr. Andhare, what would a layperson know? How would they know if they're doing the right technique, if they're using the right technique when performing CPR? What results should they expect when they're performing CPR, and at what time?
If there is only one person who is performing CPR, then the most important thing is a person should give CPR rotation at least 100 to 120 beats per minute. So at least 100 to 120 compressions per minute should be given. The chest compression should be so much so that the chest should get depressed by at least 2 inches and not more than 2 inches. It should be continued and one should not stop. If you have someone next to you, exchange the role of performing CPR so that you will not get fatigued. After the completion of CPR should be stopped only when patient regains the consciousness or medical team arrives at the spot.
All right, Dr. Singh, let's now go across to you. If you could tell us, if not treated immediately, sudden cardiac arrest can then lead to death. How can CPR help a sudden cardiac arrest?
Yeah, the purpose of the CPR is to maintain the blood supply of the vital organs, particularly the brain. And when the CPR is done in an effective way, it maintains the blood supply, it maintains the oxygen supply, and this will give us a few minutes so that we can manage everything around the patient. The most important thing about CPR to be effective and to save the patient is that when we are pressing the chest, particularly mainly in the center of the chest, not over the heart on the left side, while pressing the chest, the one has to give a time to recoil back so that the chest should expand again. More blood should be sucked inside the chest, and again with the next pressing, the further blood is to be pumped to rest of the body.
Right, and Dr. Singh, what precautions do people with existing heart conditions take to prevent a sudden cardiac arrest?
The most important precaution is that they have to change their lifestyle, because we all know that we all have a very bad lifestyle over the last 2 years, and with lot of online apps available with the fast food. We have to go more to the natural food and more to the home cooked food first and the foremost. More walking, no smoking at all, and one has to be happy and spend more time with your friends.
All right, be happy and spend more time. So basically, stress is one of the reasons that we're seeing more of these cardiac events, and people should reduce the stress in their lives.
Yes, no doubt. This is a old saying that that the stress is the root cause of most of the problems, be it depression or diabetes or high blood pressure. So one has to be. Though the stress is also important for growth also, but it should not be overriding your nerves.
All right, well, we'll slip into a short break now. We're discussing with the doctors CPR and interventions and first aid that we can all, perform to help save a life. We'll slip into a break and return with more. Stay with us. Welcome back. You're watching Health and Wellness, and our focus is on saving a life and how it's important for people to learn CPR. Let's go across to our doctors. And Dr. Andhare, is CPR treatment similar in men as it is in women? If you could explain that to us.
So definitely CPR is exactly same for both the genders, and gender bias should not be there. One of the study which was conducted in 2019 showed that 39% of women who suffered from cardiac arrest received CPR, whereas almost more than 50% of male patients received CPR by a bystander person. That means people are more apprehensive to perform CPR when a person suffering from cardiac arrest is a female. So we should not be biased, and CPR should be performed on any person who is suffering from cardiac arrest. Quality CPR is the only way to save person's life, whether it can be male or female. CPR should be performed immediately.
Right. Dr. Singh, also the worry is, can you damage someone's heart if you perform CPR while it's still breathing? Because, is it important to know the technique, and you don't want to actually land up hurting the person in any way?
There are very minimum chances that one can damage a heart during CPR, because once you are doing the CPR in a proper way in the center of the chest, the lower part, usually there is no damage. And one should perform CPR in a proper way. And as I already said, that CPR is not all about pressing the chest, it's also the recoil of the chest, because very commonly it happens that people keep on doing fast pressings and they don't let the chest to recoil back, and that is the biggest error while doing CPR. Then we waste those precious seconds, which can mean a big life.
Right, and Dr. Singh, also if there's a heart attack or sudden cardiac arrest, is it more likely to occur in people with existing heart problems or diabetes? And what information should they carry with them while they're going out?
All diabetic patients or hypertensive patients, means high blood pressure patients, they should carry the list of medicines along with them in their pocket. Usually the patients, they do that, they have the prescription slip available in their phone, and most of the phones are locked at the time of the CPR. Nobody can access the phone and can find out that which medicine patient is taking about and who is the doctor, and one should have the readily list available of the medicines what the patient is taking and his family physician or family doctor's number, so that one can get a quick information about the patient's condition from them.
All right, so that's important to keep in mind. It's helpful to others when one does suffer such an event. Dr. Andhare, how long does it take to recover after surviving a cardiac arrest, and what precautions should people then follow?
Cardiac arrest can itself be a fatal event, and prompt and correct CPR with primary management can increase the chances of survival. So many patients with the favorable neurological outcome can recover as soon as possible when the sedation has been seized off. But depending upon the neurological damage, patient can recover within can also take up to few weeks to even few months to recover from cardiac arrest. uh, After cardiac arrest, certain medications, regular treatment with and follow-up with doctor, and lifestyle changes are the most important factor which will help to reduce further event of cardiac arrest.
And can people who've suffered a cardiac arrest, can they then get another cardiac arrest later? Or, because if people should, suddenly feel that now we've had one and now we're recovering and we can't get another, is this true?
Yeah, they can again, they depending upon the etiology, means what was the cause for cardiac arrest, people usually are prone to get second or third event of cardiac arrest after the first event. So all these people should take regular medication, regular follow-up with their doctor, and lifestyle changes which are advised. So these are very important.
Right. Dr. Kluchkar, is cardiac arrest more common in males or females?
See, in India, cardiac arrest more commonly is seen in males because pre-menopausal women, the chances of getting a heart problem are very less. So, in women, especially after menopause, the cardiac arrest or the heart problem starts happening. So the stress level and the lifestyle disorders which are seen, especially in heart problems, is more commonly seen in male patients. So in India, we see that males are generally more prone, and in India, the other problem is younger generation is more prone to get heart attacks than the older generation, because in young hearts, what happens is the heart is not used to reduce blood supply to the heart. In older populations, there is some amount of blockages that starts occurring and the heart gets used to reduce blood supply. But young hearts, they are not used to reduce blood supply, and any event such as heart attack is the heart becomes very liable to go into a sudden cardiac arrest.
Right. And so, Dr. Kluchkar, is there not enough awareness about women suffering heart attacks and cardiac arrest? Do you think there needs to be more awareness about that? And at what age should both men and women then start, going to doctors and getting this checked out?
See, especially in women, after the menopause, they are very prone to get heart problems. And today, with increasing smoking tendency, which is occurring in, especially in IT industry, in BPOs, people going for airline industries, there is a lot of stress which is there on women also. We are seeing a lot of airline industry patients which comes to us with heart problems, especially women. So smoking and taking a lot of stress because of the work and doing late night duties, especially in the BPO or the IT industries where they have to match the timing with America or Europe. So they have to stay up for late nights. So this brings a lot of stress on the heart, and especially in women, they feel that the heart problems will not be there. Another problem with women is that the typical chest pain which occurs in males, they don't occur in female patients. The chest pain or the heart problems comes as a vague symptoms. So these women patients are very prone to get heart problems after menopause, or if they are having smoking or lifestyle problems.
All right, so important to keep all that in mind. And finally, Dr. Singh, we're talking about CPR, and earlier in the show, we spoke about how it's important to know CPR. If you have anyone in the family suffering some sort of, heart disease, which is very, very common, of course, for all of us here in India. So how would you advise viewers that how to go about it?
The CPR can be learned from the trained professionals. It's a very easy technique. The only thing is that we have to tell that how to lock the elbows, how to lock the palms, and how to give the pressure, and how much pressure is to be given, and at what speed is to be given. And that's why the CPR technique, it should be taught to children in the school. It should be taught to pupils in the colleges, in the universities, in corporate offices, and it should be a regular affair, ideally every 6 months, so that one should keep on reminding that one should give how to give a proper CPR. And secondly, don't hesitate in giving CPR to anybody. If somebody thinks that somebody is feeling is unconscious, and the most important thing is sometimes you see somebody is having a cardiac arrest and on a bed. The important point is that while doing CPR, the surface under the person to whom the CPR is given, it should be firm so that your pressure can be transmitted properly to the chest. So it is very important that the posture of the person on whom the CPR is being done, the person should be on a firm surface, and the person who is doing CPR, his position should be adequate so that he can lock the arms properly and so that can transmit proper body weight onto the person's chest for a proper compression and proper recoil.
All right. Well, thank you so much, doctors, for joining us. And it's important for everyone to educate themselves because, that little bit of education, little bit of effort can go a long way in helping save a life. Thank you so much, everyone, for watching. Goodbye.